Good morning everyone and welcome to the Contact a Family webinar. Now there are many attendees this morning, so it won't be practical for verbal questions to be taken, therefore you will all be muted throughout. If at any point you have any questions, please use your question icon on your toolbar on the screen and this will allow you to put your question in the text box. Now we'll select relevant questions at the end should time allow. If you have further relevant questions not covered in the time allowed, please I urge you to get your questions into the Contact Family website and they will produce a frequently asked questions and host it on the Contact Family website with the webinar. At the end of the webinar there will be a short questionnaire we'll launch and please take the time to complete this as your feedback is valuable for future training. Okay, we're about to start the Reach Out a Little Further webinar, Building an Inclusive and Credible Forum, and I'll just make some brief introductions. Before we begin, I'll introduce myself. My name is Lorraine Pattison and I'm Associate Consultant delivering on behalf of Contact a Family today, and my career spans over 30 years of working with children and families. I have 15 years in the private and voluntary sector supporting children and families with childcare and training, 5 years in the education sector delivering qualifications in psychology programmes, and 10 years in a local authority delivering workforce development leadership programmes, and as a strategic manager delivering on the short breaks for disabled children. Recently, 5 years as a training consultant delivering to the 12 North East local authorities on the legal aspects of the Children and Families Act in relation to the single assessment, education, health and care plans. So that's me. Now today I'm pleased to say I'm joined by two parents from Bolton Parent Carer Consortium, so I'll hand over to them to introduce themselves personally. Ladies.
Hi, I'm Jacqui Byland. I'm I take the lead on the Self-Employed Families subgroup. I'm a parent and carer of a disabled child, and my passion and my work experiences of inclusion of disabled children.
Hi, my name is Steph Sherratt. I'm Vice Chair of Bolton Parent Carer Consortium. I also represent the group Breaking Barriers on the consortium. I'm mum to 2 children, the eldest of which is a disabled child, and I believe very much that any decision made about disabled children should involve the families and have the voice of the children themselves included.
Thank you, ladies. So this is introducing the webinar. It's intended to support forums across the country to reach out a little further, support you to build an inclusive and credible forum, and promote wider participation by reaching out to those families who are often labelled hard to reach. The duration of the webinar is an hour, although hopefully time allows we'll be able to get everything in within the time scale. So just to have a look at what we hope you will take away from this webinar is partnerships and networking, and a look at inclusive practices, the emotional psychology that prevents people from joining their local forum, the practical barriers faced by families, and hopefully strategies to remove those barriers to promote wider participation, equality and diversity, and marketing and promotion. And just to set the scene slightly, building an inclusive and credible forum, we recognise that forums across the country will be at various stages in their structure and development. Whilst forums are well established with wider family members, others are recruiting new members and some are beginning again for a variety of reasons. But whatever stage your forum is at, we hope this webinar will help you to become an inclusive and incredible forum. So going straight in, we ask the question, what does inclusion mean? Well, inclusion means everyone. Inclusive practice is an approach to enable and empower carers to access and contribute to the forum, feel valued and listened to within the forum, and respected and acknowledged. Now this slide here highlights the protected characteristics that are mentioned in the Equalities Act. And the Equalities Act brings about responsibilities of community groups and associations, which includes forums, and the Act sets out the protected characteristics mentioned in this slide. So the responsibilities for forums under the Equality Act relate to inclusive practice. So forums must not discriminate against people or treat them unfairly on the basis of these protected characteristics, known as direct discrimination. Forums must not do something which will have a worse impact on someone because of a protected characteristic. That's an indirect discrimination. And you must not treat someone less favourably because they have complained about a discrimination, as that is victimisation. And you must not behave abusively or disrespectfully towards someone with a protected characteristic or tolerate this from any other forum member, as this is known as harassment. Now you can get a copy of the Equalities Act, and I'm sure we'll be able to put a brief guidance up on the webinar. So inclusive practice, again the bullet points: you must challenge negative comments and stereotypes within your steering group, your wider membership and any other arena. Good practice states that you should develop, typo error there, sorry, you should develop an equality and diversity policy and make sure you let committee members, staff, parents and representatives know about it. Develop a code of conduct so that everyone is clear on the behaviour that is expected and put on training for members. And you must make reasonable adjustments for disabled people to access your service. And forums should also take positive action to identify groups not represented, plan and take action to reach out to these groups. Now it has to be said that there's lots of forums who are already doing this, but this is just to give you the bullet points within the Equalities Act to reinforce inclusive practice. Diversity, self-explanatory. The bullet points here talk about culture, language, gender and transgender, appearance, lifestyle, sexual orientation, lesbian, gay, the bisexual and heterosexual communities, social and economic circumstances, family structure, abilities, whether that's physical, social, creative, intellectual, and values and beliefs. Sorry. We're looking at here barriers for some parents who don't attend forums, and those barriers include working parents who cannot attend events, maybe the timescale, parents who have had a negative experience of a group in the past, parents who speak English as an additional language, parents new to the country and who have little experience of this culture, grandparents who may be the legal guardians of children who don't respond to flyers advertising to parents or feel it wouldn't be appropriate for them, parents with low self-esteem and self-confidence, single parents, which could be mums or dads. Dads may have no direct mention in your marketing and promotion materials. Parents with no extended family members, so therefore they cannot get to meetings because they've got no babysitters. Or parents who feel they have little to contribute to a group, feeling that to come along to a group they have to bring with them some sort of skill. It could be young parents, teenage parents, parents in mainstream settings who maybe don't think that the particular forum would meet their needs, parents who are disabled themselves, or parents who homeschool their children. Other barriers may also include disabled parents, parents with transgender, sexual minority groups, same-sex parents, parents with mental health issues, parents on low income or benefits, parents who have difficulty with literacy and numeracy. So all of the above bullet points could have a direct impact on the confidence and self-esteem of those parents, carers. This slide really is just to say that when we make reference to the wider family, we don't just mean mum and dad. It is meant as a fully inclusive term, which includes grandparents, foster parents, adoptive parents, or anyone in society with parental responsibility, caring for a child with special educational needs or disabilities. It may even be that you have a neighbour who could come along to your forums to collect information and pass on to the parents if they're unable to attend. I quite like this slide. It just explains about inclusive practice. So inclusive practice for forums provides opportunities for all cultures and diverse groups of people to access support. feel welcome to come along, develop new friendships and find out what is available for their family. Feeling welcome and included and helps build and strengthen peer relationships and promote an understanding of diversity and respect. I just want to read a couple of notes here that it's recognised that not all areas across the country will have a high percentage of BME groups. However, no matter where we live across the country, there is a high percentage of diversity. Whether that is cultural in the family unit, extended family, no extended family, feeling socially isolated, new to the area, those with special needs themselves, those parents who are painfully shy, those parents who are single parents may feel having low self-esteem, and those parents suffering fatigue, exhaustion. It's how we approach and reach out to these families, how we advertise to these families. So all of the aforementioned issues around inclusive practice can have a fundamental effect on whether people participate with a stranger in a new group or not. I've left this slide up because I think, are we getting the message across to the wider community about families who are disengaged or don't feel that they could come along or have nothing to offer? Is letting them know that the strangers are only friends that they haven't met yet. This slide reinforces equality matters, and the 2 bullet points are around to be mindful about the people like us theory, only attracting people with the same views and interests as you. This is particularly key for leaders of forums. It's important to involve people with different views and interests and ideas, and this keeps the forum fresh and builds inclusivity and also promotes diversity. Emotional psychology is huge, as it's a range of emotions that prevent people from accessing forums. So I'll just read the slide. We need to recognise that although some individuals have physical, cultural and psychological differences which affect their everyday lives, some elements of society or other people's reactions to these differences contribute and can disengage people further. This makes them feel less confident to come along to new events, and there may even be physical, environmental barriers, organisational barriers and attitudinal barriers. And if these, it is these barriers that result in people being excluded or labelled hard to reach. The next slide I'd like to show you is how the range of emotions that people go through. This slide demonstrates Fisher's personal transition curve. People use it a lot in leadership training and programs, but there's no getting away from the fact that psychologically this is a range of emotional stages that people go through. This shows a range of different stages during a change period in their life, particularly relevant when a family receive a diagnosis that their child had a disability. So they go through a range of emotions. And as forums, you are dealing with parents like this who will be experiencing these different emotional stages. With a new diagnosis, there may be that disbelief or feeling isolated. Some of you will have personally gone through this. You'll have gone through this emotional curve and maybe come out the other end at acceptance stage. And for you as forums, you want to make a difference to other families through the work within your forum. For some parents imagine that everybody is coping better than themselves, and we all have our own coping mechanisms, helped or not by other factors in our lives. So we need to be mindful of the emotional cycle that parents go through. Some of these feelings that people feel, they need to be validated because they're real feelings for these families, and they need to feel that people understand and accept the feelings that they're going through. And some of their feelings can be irrational. what families need is for people around them to have an empathetic ear, and they need to be exposed to an encouraging environment. Also, we need to be mindful as well that people go through these emotional stages it's certainly not in any order, and for some parents they can actually get stuck. So the forums will help these parents to move forward. So for me, it's about how forums have different approaches on how you work and engage with people at these different emotional stages. Recognise the emotional stages that the parents are experiencing and help them, or even signpost them to other organisations for additional support. Obviously, some forums across the country do offer this additional support, and some of them even have funding from other grant sources to provide additional services. This slide looks at the emotional and psychological barriers. So for people not identifying with other members, there may be mistrust, which is a stigma. They may have special needs themselves. They may feel helpless. They may have hopelessness feelings, a sense of complete isolation, feeling no one else likes them. They experience depression, denial, guilt. They need acknowledgement. They may have low morale. Maybe because of their newly diagnosed parents. In my experience, parents of newly diagnosed children definitely go through a period of denial and a range of emotions. That emotional curve is huge. The wording of your marketing materials may be misleading and off-putting. You're not drawing people into your workshops because you say you maybe be offering parenting programs, and whilst this is what you're offering, it's getting out that, reaching out that little bit further and maybe changing some wording so that those groups who are disengaged or labelled hard to reach feel that actually what the forum offers is actually something that would be a real benefit to these parents. What makes it hard to reach for some of these parents, carers, could be accessibility, poor communication in your advertising, never enough time or warning given when information is sent out, social media feeds their needs, and you have to ask your question, do they? They may not have extended family members, and maybe you're not using your allies and networks wider, professional networks, local sources, charities, organisations. Now we have to say here that we are aware that there's lots of forums across the country that do all of this, but this is a webinar to actually reinforce the barriers that are preventing people from accessing forums and more wider community groups. Another thing that we can look at is the forum leadership styles. So the style and approach of forum leaders is vital to promoting the inclusive development of the forum. So you need to create a trusting and nurturing forum that people want to be part of. And remember that for the parents that already know you, they know they can trust you, they know that they can come along and they'll be supported and listened to. These bullet points are for these new parents that are coming along to your forums. So they need to feel the atmosphere is a supportive atmosphere. How do other people perceive your forum? What messages are out there? What's the Chinese whispers that's going around out in the community? Maybe unconscious messages that people pick up on. How does this impact on the public perception of your forum? And remember that Chinese whispers is always distorted information when you get to the end of Chinese whispers. I've also put a little icon here at the bottom of this slide which promotes the Parent Carer Forum Handbook, and that's a very useful resource. It's a point of reference for forums, so if you're wanting to give your forum a revamp and you want to look through at your policies and procedures given in line with all the new sort of legislation and acts that are coming out, or are out I should say, sorry. And then maybe even actually taking a step back and reflecting on the leadership styles within the forum. Is there other parents in the periphery that actually would like to step up or come forward? Do you know who they are? So these kind of things is having a real look at the existing forum and looking at who else can come on board. It's my experience from a local authority point of view. It's always the same group of parents that seem to be the driving force behind parent carer forums. They're the ones who are proactive, and that is fine if there's other parents who want to come in, and making sure that you actually bring them into the front as well. But that booklet, I'll make reference to that booklet again, it's a fantastic resource on Contact a Family website for you all to have a look at. I want to just highlight here some practical barriers. So there's some parent carers and wider family members are not in the usual networks who you target with your email mail shots. Maybe you could start looking at expanding your networks. Another practical barrier is they can't get to the venue, they're on low income, they don't have a car, there's no bus service. So rurality is another barrier. They cannot make the date or the time. The venue or the meeting isn't accessible. They need interpreters, maybe ramp lifts, or speech to text reporting. Food doesn't necessarily meet the cultural needs, for example, halal or vegan. The agenda doesn't suit. It does not fit with their life at the time, for example, a survey on wheelchair services. They don't want to be amongst a certain group or won't go to certain towns, villages and areas. That's a biggie. I can remember that from a local authority trying to get parents to move from one part of the county to another, even if it was only like 10-15 minutes apart, they just wouldn't go. So there's those kind of barriers that need to be overcome. This is huge. Suffering fatigue from a particular subject. For example, the local authority constantly asking for views on short breaks. I can relate to that. They used to lead the short breaks. You want feedback from families, but sometimes it's just too much. And for some families that I've worked with in the past, they've had over 100 professionals engaged in working with their children, and they're having to go to meetings, medical appointments, constant. So asking for more feedback on, for example, short breaks, they just become brain dead because they're around the actual the content of the feedback that they're being asked for. How many times do they have to ask about their views on short breaks? It's an annual review for parents to help them with their short break duty, but for some parents it's a constant bombardment of questions around the same particular subject. And that becomes tedious, especially if families are suffering fatigue themselves. So that you need to be mindful about that when you're doing your promotional material. They have a large number of, I've already said that, they've had a large number of professionals involved with their child and constantly at meetings and appointments have said that. But even exhausted parents would come to events, but some need a hook to get them there in the first place. Once you get them there, it's up to you to ensure that they see the value of coming along to your events. So the practical barriers, so some parent carers will find it hard to reach if what you are offering does not appeal to them. They don't see the value of or how it will benefit them or their family. And whilst you will have experience of how these families are feeling, the key is for you to step outside yourself, walk a mile in their shoes, reevaluate and reflect upon what your aim is, think about the world that they currently live in right now, seeing it through their eyes, and remember, you've been there, you know what your forum can offer, these families don't. So again, that's about being clear and using the right language, reevaluating your promotional materials, your policies and procedures, where you engage, and then how you present yourself at posters. I'd like to share, just before I introduce the ladies from Bolton Parent Carer Consortium, I'd like to share the next slide with you. I love this slide, this quote. It's a quote from Albert Einstein that says the definition of insanity is doing the same thing over and over again and expecting different results. Now, for some forums, they'll feel, well, we are proactive, we're constantly sending mail shots out, and we do engage with wider communities, but we still don't get the take-up to increase our participation. Well, again, I'd like to reinforce this slide. Do something different. We need to make some small changes, small improvements, just do things differently in order to help remove the barriers and reach out a little further to those families and wider communities in your area, which we'll cover in a later section. But before that, I'd like to introduce Steph and Jacqui. They will be sharing what they did in Bolton to widen participation and their membership following an area of improvement they identified as a priority for them. And I'll now hand over to the ladies.
I'm Jacqui, just to remind you. I take the lead on the Seldom Heard group. I'm just going to take you through how Bolton Parent Carer Consortium was created. So in May 2014, life started with 7 voluntary sector groups who met to become and develop as a constituted group called Bolton Parent Carer Consortium. Initially, it was ZACS, Breaking Barriers, Greenfield Parents Group, Day Trippers, COG, Imagine, Shorey Conflict and Prevention, BAS, Parent Representatives on Task and Finish Groups, and Kids Together. We also had information advisory services, was Parent Partnership, and independent support, and that's through IAS and the Together Trust, who are the independent supporters for our post-16 in Bolton. Burton Shaw, which is an independent special school, Bolton Lads and Girls Club, Bolton Smart Enterprise, Action for Children, and they are known as associates. We also had Runworth SEN School as a partner. So that's how life started for us as a consortium. We currently have open and closed steering group meetings, and we decided after 12 months that we would look at subgroups, and one of them being seldom heard families. We really had a bit of a dilemma as to what to call it, whether they were hard to reach families, but we felt if we knew where they were, why were they hard to reach? So we sort of plumbed for 12 months to call them seldom heard families. And we weren't really sure who they were, to be fair. So we agreed we'd start to meet, and we'd meet every month, and then we report back the information to the steering group. We had a small budget to cover the costs of this priority area from the main government grant. So how the subgroup came about? Well, in 2014-15, we applied for the discretionary grant to achieve this aim. To access ways to promote Bolton Parent Carer Consortium and to support families who may be seldom heard or hard to reach in communities where English isn't their first language, and to break down a communication barrier. Well, I started, we worked with an Asian family who helped us forge links with Bolton Council of Mosques, known as BCOM, and in turn we now have links with the 24 mosques in Bolton. We met regularly at BCOM to become familiar with the local community and familiar with the staff in BCOM so that it would get to know our faces and break down those barriers of communication. And in April 2015 we organised an open day inviting the local community, mosque leaders and local providers having a small marketplace. I think what that did for us, that made us realise that we sometimes have to take a walk in somebody else's shoes, and that's exactly what we did on that day. The local community provided the food, and we were all invited to participate in that food. And we had, in the Asian community, everybody sits down together at a big table and everybody enjoys that food, and it was very much a family event, and that's exactly what happened, and it was a delight to be involved in that journey. So what happened in Bolton? So we used part of the grant as well to translate our A4 double-sided leaflet. It advertised the open day, one side on English and one side in Urdu, and this went out to all the primary and secondary schools in Bolton who had Asian families. It was given out to all the mosques via BCom. We also translated and printed the Bolton Parent Carer leaflet, which is A4 with like a membership piece to rip off, and our SEND brochure in Urdu. What we did as a consortium was we looked at the SEND reforms, special educational needs and disability reforms, and thought what information would be really useful for families in a bit of an 8-page guide. And so we created SEND brochure, and we also turned that into Urdu. Our leaflet has been distributed by the BCom manager to every mosque in Bolton. The grant was also used to offer a workshop to our Bolton Parent Carer Consortium members and parent carers, and it was aimed at us having a better understanding of other minorities. We looked at myths surrounding a variety of cultures based on Bolton's population, and we used a local firm, Debonair Languages, to deliver this workshop. And the feedback from that workshop for our members was that it opened their eyes to the myths, to the Chinese whispers that was previously mentioned, and to say, you know what, we're not going to engage in any of that. We're going to look at each individual family for what their needs are. So what have we learned from 1 year on? That we have to go at somebody else's pace. So the open day had to be within the Easter holidays, as that's when we would attract the local community. To offer local cuisine that was made by the male elders at BCom, and I have to say it was absolutely delicious. And I have a gluten-free diet, and I was taken around the kitchens by the male elders, and usually women are not allowed in the kitchen area, and they showed me all the produce and all the food, and then I was given the biggest curry of my life. I had plastic containers to take it all home for the next week, and I loved every minute of it. And also that we can't reach everyone at the same time, and year 2 will obviously prioritise based on our Bolton's population. So year 2, we have forged links with ACES, which stands for Achievement, Cohesion and Integrated Service. So in Bolton, ACES is the first point of contact for families coming into Bolton. So if you're a refugee status in a refugee camp, you're an asylum seeker, you're EU country migrants, or you're EU secondary migrants, and migrants from outside of the EU using a visa. I have to say, as a group, I think we all feel it's been quite a fascinating journey to date to get an insight into what a family experiences upon arrival in Bolton. And I would wholeheartedly recommend that if you have this kind of service in your area, you go and meet and chat to them, because it really, really opened our eyes to the barriers that many of these families face. So after the meeting with ISIS, we almost went back to basics. We, as our seldom heard subgroup, we sort of started to look at, right, okay then, so families come into Bolton, so how are they going to access the internet? Can they use our website as a starting point? So we now have links with local Asian families who use BCom as a meeting point, and they have agreed to look at our website and give us their feedback. So we started to use Google Translate, and whilst we appreciate that's not brilliant, it is a starting point. We're looking at redesigning the homepage to have buttons to press to locate our leaflets in different languages, which we've used a local firm to have those translations done. We looked at priority languages in Bolton and have recently translated our leaflet and our SEND brochure into 4 more languages. We designed a basic A4 poster to signpost families about education, and this would form a discussion about what to do next. After going to ACES and having met the local people at BCom, what it made us realise as a group is that when you come into the country, you may not be aware of the education culture, And one family said to me, yes, well, how do you fund your child going to college? And I said, well, they're entitled to a free education till they're 18 and up to 25 if they've got an education, health and care plan. And that family just didn't know that, and we take so much for granted about what we know in Britain, and we've actually got some really, really good rights, but it's knowing them. So what next for our seldom heard subgroup? We've recently made links with BRASS, and that's Befriending Refugees and Asylum Seekers, and plans are in place to further this opportunity. We've looked at the who is seldom heard, and that has probably created more questions to answer than when we started. And we realise that any family can be seldom heard because what you don't know, you don't know. And we will continue to look at creative ways to engage, and in 2016 we'll also be doing that through health and social care. We have been very fortunate to get another discretionary grant for this year using health.
What we started to look at with health as a basis was the fact that with the SEN reforms and the EHC plans, health for the first time was sort of coming into work with other services, and that was a complete shift in culture for all families. So we applied for and were successful in obtaining a discretionary grant, and at the moment we're working towards putting together a handy guide to the health system and how it all connects in, what can be self-referred, what needs secondary referring for families of disabled children and young people. What also came out of those initial conversations was how far-reaching the term seldom heard is, and that language is a barrier or culture is a barrier. Another huge barrier was information and how the information is put across, how easy it is to understand, how diverse that information is for families. So what we've decided to do as a forum is to further the work that the Seldom Heard subgroup did, which I was also a part of. So I was part of the realisation that this touches just about every area for parent carer participation, is to work that through not only the discretionary grant, but we're also, Bolton Parent Carer Consortium are the Northwest Health Pilot working with CAF. So we're going to carry on that theme through the work we do, looking at transitions and how that information goes to families, working through translations as well if English not as a first language is the biggest barrier, but realising how much work there is to do, and it has to be ongoing work through all of the groups and working groups that the consortium puts together, hopefully over at least the next sort of 2-3 years, and that it is circular really, because just when you think you've got it all covered, you think of something else, or you realise there's a group that you haven't got to, and that they have completely different ways of engaging or being communicated with. So unless you know that, or you can be educated to appreciate that, you've got to go back to the beginning again and build up those relationships and that trust. But it's very interesting, and the more we learn about it, the more we realise that the work we've done over the last 2 years with the Seldom Heard subgroup is going to filter through all the work we do, and it's going to be really good that now works alongside the other pieces of work that we're starting and the plans that we've got for the coming 12 months.
Thank you.
Thank you.
Hello, it's Lorraine. I'm back again. I'd just like to say thank you to Jacqui and latterly Steph there for giving us what was quite an inspirational story, and it's quite uplifting to hear that this good practice is going on in forums, and bearing in mind that these are parents of disabled children doing this work and becoming partners and making a difference, and actually sort of the champions for change really in the world of special educational needs and disability. So I'd like to thank them both for their contribution to the webinar today, and hope that you've taken some inspirational guidance from what they've just talked about. So thank you, ladies. Thank you. Let's like to move on now to the first steps in understanding your current membership via your databases. So asking yourself really, what information do you capture? Is it just names and addresses, email addresses, or do you have a specific database and membership from which captures postcodes, that demographic stuff, the date of birth, the disability or additional needs, the age, of the main carer, the ethnicity. Now there is an example of a membership form as a handout with this webinar, and I'm sure Helen, the administrator for the webinar, will make sure that those documentations are uploaded on the Contact a Family website with the other resources that go with this webinar. This one here looks at which diverse groups are living in your community, just like the girls have just discussed how they reached out to the wider community. Your local authority must produce information about the local population and a joint strategic needs assessment with the clinical commissioning groups, the CCGs. They must also produce, as we've mentioned before, a short break statement which outlines the following for families in local areas: the range of services that's available, any criteria by which eligibility for those services will be assessed, how the range of services is designed to meet the needs of parent carers in their areas. And there's also the wider Office of National Statistics. They have a range of information, and you can compare or find out about regional trends at the link. You can also talk to your local authority and find out what the demographics are for your area, and then look at your database and find out which groups are actually missing. This is about building partnerships. So these are just some other points you don't have to do it all yourself. So most local authorities have a good link in with their parent carer forums. So you've got local authority and clinical commissioning group leads, and what doors can they open for your forum. There's the lead officer at the portage, there's the voluntary sector networks in your area, and there's the local authority outreach teams, the LIST teams they may be called, they're local inclusion support teams. There's also the SENDIAS team, and they're the Special Educational Needs Disabilities Information Advice and Support Services. And some of the SENDIAS teams actually, they host the local offer web pages on the local authority websites, and that's about promoting short breaks and what other organisations are out there for support. There's the lead officer in the Family Information Support Service, and in some local areas this team of staff actually host the local offer web pages. There's children's centres in your local areas, managers, locality managers, family support officers, early years, local preschools, nurseries, leisure centres, health centres, everywhere possible in your local area where families would go. Your local short break providers. When I was working for a local authority, we had a short provider network, and we got them all together and we started promoting how they could actually engage and work with us, the local authority. So we promoted to parents the short break provision, and they promoted to parents parent carer forums, etc., etc. It's a bit of a win-win. You've also got the child development centres, hospitals, clinics, GPs, surgeries. And here's the new one, local shops, specialist shops such as those for equipment specialists. The girls are nodding here, so I'm assuming that they're already starting to go down this route of engaging wider. So specialist food shops such as Polish supermarkets, Chinese supermarkets, community networks, community centres, village halls, churches, mosques, temples, and other religion or community-based. So I'm pleased to say that the girls have actually went into more in-depth information on how they actually engaged with the wider community there. So building and planning your inclusive and credible forum. So you've got your databases. They capture numbers and provide evidence that you can use to demonstrate how useful and effective your forum is to families. And that could be when you're actually asked to provide feedback to, say, contact family, the DFE, if you're applying for grants. You're already gathering all that data, that really useful information that actually evidence how your forum is actually reaching out to wider communities. So a suggestion for maybe get in touch with your performance teams at the local authority, as they're the ones who, there may be different departments within the performance team that actually gather the demographic information within the local area, and they would actually be able to tell you gaps in your communities and parents, and they'll be able to give you the information to assist you in widening your reach. And it could work both ways for the local authority as well, as it becomes a really strong win-win partnership of information sharing with the forums and the local authorities. And again, all the organisations that we've mentioned in this slide. So how does your forum get information to parent carers in special, mainstream or independent schools and colleges? So just get an example here of Lincolnshire Parent and Carer Council. They sent out the forum leaflet, a survey with a reply paid envelope to all schools in their area with help from the local authority's courier service. And as a result, they had over 2,000 replies from parents and carers who all became members. Other forums attend school parent evenings and open days. They put information stands up, and a team of forum ambassadors who actively promote the forum actually capture key issues faced by families. So I suppose the key message here is looking at making it person-centred. You hear person-centred in the SEND reforms, the Children and Families Act. So I suppose it's about promoting your forum as a person-centred organisation. Make your presence personable, so where possible when you're at events, get out there among the parents. Don't just stand behind your stand holding leaflets to those families who come forward. Get out there and talk to the families. Find out how you could help them and support them. Have a clipboard with you if to take names and contact details, and then make sure you follow up with an email or a phone call or send them information. Start creating databases. You could even look at a database for each school so that you could actually send that information direct to individual schools to disseminate to their parents. Ask schools if you can put up posters and drop off leaflets. Inform the schools in your local area of local parent events that you are hosting as a forum. Let schools know about conferences so that they can include it in the school newsletter. And then this slide really is removing the barriers. It's about what we said before, making small changes, changing the way we do things, and find a way to remove the barriers. So there is a way to do things better. It's a famous quote from Thomas Edison. There is a way to do it better, so find it. We're now going to go on and look at marketing and promotion and how that affects the number of people who engage. So we've looked at communication as more than words. It is the exchange of thoughts, feelings, information and ideas between people. Spoken language is just one method people communicate by, but it is by no means the only one. Fundamental to your marketing and promotional materials is getting the message across. People need to understand fully what's in it for them, what's on offer, what's involved, what's expected of them, if anything, and how will they fit in. So it's just that what's in it for me question, and that should help you when you're doing your promotional stuff. So just being mindful that not all parents want or can be involved to any great extent. So ensure there's a variety of ways for parents to contribute. Some parents will need to get to know you first, like you, trust you, we've mentioned that before they may be willing to commit to anything more than just attending an event or receiving a newsletter. Find out how other forums promote themselves and their activities, and look at other forums' websites and make sure you keep yours up to date. Have more than one way for parents to join and communicate with you, and use symbols to show people that you're fully inclusive and that your forum is also there for them. Remember that participation can also mean different things to different people. Some just want to access information or be signposted to. Others like to attend local events, forum meetings or conferences. Others want to take an active role in volunteering. Some may like a leadership role, and some may just want to sign up for email contact just so that they stay informed. But inclusive practice covers many areas, so we need to ensure that our leaflets and posters and how we market things just get out there to further reach, and we need to ensure that the language in our promotion material advertises the support offered rather than leaving the reader to make up their own assumptions about what it actually means. So parents' attention may not be grabbed by headlines such as "Come and help us shape and influence services," "Parent participation, come and have your voice heard," or "Come and join a strategic committee and get involved." They're more likely to respond to phrases such as, "Does your child have additional needs? Are you getting the help and support and help that you need? Help us to make a difference. Come and meet other parents and carers of disabled children and those with additional needs. Develop new skills and increase your job chances," or learn about services and support available. So marketing and promotion, I like that little everyone smiles in the same language. Language we use can be that essential difference to getting a clear message across and improving participation and attendance. Ask people who don't know anything about you to look through the information that's in draft form before you actually publish it. See if they actually understand what you're trying to offer or trying to encourage or attract families. Maybe find a hook to include on your marketing to attract families to come along to your event. Just one of these hooks could be a Max card. Max card offers discounts at family attractions. Some forums use them to attract new members and then linking this up with the disability register, or they offer them as a standalone offer. So through consultation with families and community groups and research into what else is out there to help families, as most of you will be aware, there's lots of organisations that offer free help and support, but for new families they don't know. It does not need to be a money-orientated hook. Some of them may just need conversation and signposting. So it's about how you are promoting what you offer. These are some thoughts to link in with marketing and promotion. I mentioned earlier that I used to deliver the legal aspects of the Children and Families Act, and I'm really passionate about Section 19. Section 19 is about respecting and valuing the views, wishes and feelings of families, children and young people and families, and promoting participation in whatever form that support, choice and control, and encouraging collaboration in order to contribute to making a difference. So the Section 19 principles are designed to support participation, and I don't just mean lip service to participation, I mean proactive participation, not just having a meeting with parents sitting in a meeting and not contributing, actually having their voice heard and having a say on their child and the services that support and scaffold that child. That's what I believe participation is. It offers greater choice and control. It also promotes collaboration between the education, health and social care professionals, and furthermore to support high quality of provision to meet the needs of children and young people with special educational needs and disabilities. The next four slides here actually highlight examples of what other forums are doing to widen participation. So here Brighton and Hove meet regularly with the lesbian, gay, bisexual and transgender switchboard, and one of the parent reps on the steering group is a representative of the lesbian, gay, bisexual and transgender communities, and they plan to do more targeted outreach work in the future. Some more successes here around Bradford. The Bangladeshi community, they spent 18 months linking in and working with leaders in the Bangladeshi community in order to be able to hold an event at their community centre. And for Bradford, the Bangladeshi community have many families with multiple children with disabilities and also children with many health needs. So they used their links with Barnados, who were already working with the Bangladeshi Community Association, and through that partnership work with them, they introduced to their committee members who realised that we could support, their forum could support and gather the voices of many of their families in order to improve and influence the services they received. Quite a number of these families had no services or very few, and we were able to hold a chill and chat and chew event at the community centre, and they've never looked back. They've increased their members, they've gained the trust, and are able to feed the views of those families to the necessary services that can support them. Slough take their laptop to events and encourage people to sign up to the disability register and help them set up an email if they don't know how, and they use translators to reach the BME groups. Gloucestershire use a mobile projector to meet groups in their community buildings to tell them about the forums. Excuse me. Just some more. Sorry, I've just been given a little sign there. South Gloucester have a dedicated person to support and train volunteers and tailor roles to their interests and talents. So no matter how long they can commit for or how little time they can offer, to ensure that they stay engaged. Cornwall uses Facebook to reach parents across the rural community, asking support groups to consult with their members and feedback to the forum. Islington put on a film night for dads, which has been really successful in attracting new dads and enabling them to get involved. Fair to say here that there will be many more success stories in forums across the country. These are just a few examples that are being offered to help others with ideas, to help them reach out just that little bit further. I love this thought-provoking story. So this is, the tide has gone out and has left 1 million starfish on a beach. They are slowly dying under the heat of the sun, and a little girl is walking along this beautiful sandy beach. And she walks, picks up a starfish and throws it into the sea. She then picks up another one, and she keeps throwing each one back into the sea until an old man comes up and says to her, "What are you doing, little girl?" So she kneels down. She said, "Oh, sorry, I lost my place there. There are millions of starfish out there dying. You cannot make a difference." So she kneels down, picks up a starfish, throws it into the water and says, "Well, I've made a difference to that one." Individuals cannot necessarily change the world, but you can make a difference, and collectively as a forum group you can influence change for the better. So you may not be able to support and help every parent, but if you can help just one family, then you definitely have made a difference to that family. I like this, and you've probably gathered by now that I'm a great fan of inspirational quotes just to get the message over. So if we did all the things that we're capable of, we would literally astound ourselves. We are coming to the end of the forum, the webinar, and I just wanted to offer you this action forum. Just shows how you can actually reflect and help you action plan within your forum. You'll come up with your own headings. This will be included as a handout. Feel free to amend it to meet the needs of your own forum, but it's just a little example template to help you start action planning to see how you can reach out to the wider community and reach out that little bit further. I wanted just to include this planning for the future, as training is fundamental to the success of any group. It's good practice to upskill other members of a steering group or a wider forum so they are skilled and prepared to take over a role in the event of another parent moving on. Forum leaders should adopt a community development approach. That's that coaching and mentoring others as a model that ensures everyone has the appropriate underpinning knowledge that can be put into practice. I mean, we know that there's a wealth of knowledge and experience out there among the families, and that there's loads of parents that are really proactive, but sometimes it boils down to a small group of parents. So we need to make sure that that underpinning knowledge, support and practice gets disseminated out across to those parents who want to be involved more. I have mentioned the Parent Carer Handbook. I just think that this is a really useful reference resource. It's on the forum handout, the Contact a Family website. Great sections on looking at leadership styles on pages 62 to 65 to reflect and move on and make changes. And I think we're just about coming to the end. And another one of these great slides, coming together is a beginning, keeping together is progress, but working together is success. And I'm sure this slide could sit in a load of forums across the country's websites, because that's what they're actually doing. Those good practice stories, case studies that we've heard from Steph and Jacqui. So the progress that they've made in the working together in the local community is inspirational stuff. And we can all do this if we just make those small changes. I think we have a couple of questions in, and they are both questions, I'm very happy to say, are for Jacqui and Steph. So I'm just going to leave the driving seat and put the ladies back in, and then I'll come back to say bye.
Hi, it's Jacqui here. We have two questions. The first one is, how did you measure the response of your translated leaflet? The feedback that we get is our target audience don't read their language, and also we have 3 main community languages to cost the high. That's from Carol. We are still in the process of sort of reviewing that. What we did learn is we went to the right people to ask the questions about Urdu, for example. Families read Gujarati, Punjabi, but the main language for reading is Urdu. We learnt that because of the cost, we now have the 4 translated languages on our website rather than printing them, so that other organisations or parents and carers can print off their own leaflet, which reduces the cost for yourself. And we are still on that learning curve in some respects. We have now from ACES got a list of the languages for Bolton, and we will be translating them in priority order as we go along. We can't be everything to everybody. The second question is, can I ask what advice would they give forums on how to ask the local authorities for help? Example, disability register, working with IAS, newsletters, etc. Just wondering if presenters have ideas that forums can try and get the local authority to help reach the wider, more diverse groups of parents. And that's from Sue. Well, Sue, we approached, personally at Bolton, we approached our social care team who have, it's called a record in Bolton, that's our disability register, and they agreed that we could send out our leaflet and they would fund the postage, but it would be a one-off. We weren't allowed to look at the labels from a safeguarding perspective, so we envelope stuffed 1,000 leaflets and presented those leaflets to the local authority, who then put the labels on. A learning curve for us was that was really early doors, so that was maybe 2014. I don't think we explained ourselves very well as to who we were, and you know what we learned from that is be very explicit with your information, get a letter in there, and using the examples that you've seen today, get parents to engage.
And it's back to Lorraine here. Just from a local authority perspective, if you can get in touch with your CENDIAS officer, I mean, those officers is who give the advice and support out to families. They may be able to help you as well getting in to the local authority for mail shots, etc. Family Information Service, who host websites of all the different provisions in your local authority area, that's another good contact for you to have. And like Jacqui's just mentioned, your social care teams, I would find out by contacting the local authority direct, your disabled children's social work team manager. She may be able to then signpost you to a different department within the local authority. There's loads of ways in, loads of ways in, but that's just an example from me, but I'm going to hand over now to Steph. Oh, sorry, Jacqui.
Just to let you know that within our consortium we have IAS as a rep, and that is a parent and carer. So information advisory services have a key role within our organisation, our consortium. So get in there, talk to them, be supportive. And I think Steph just wants to make a point.
It just follows on from that really. When you're trying to engage with the local authority and organisations within the local authority, it's not going, if you like, with a blank piece of paper, but starting off the conversation is, this is what we can do, this is what we'd like to do, we'd like to work with you to do that, and here's some examples of how this has worked really well in the past.
An example of that is we've just been approached by our local authority to review the SEN transport policy. They recognise changes will have to be made. We know there's going to be a cutting of costs, etc. And we said, consult and do this as a co-produced event. And they've recognised that and acknowledged that, and that's our starting point.
I hope the answers to those questions were informative for you and help you just to get a few ideas on who to contact within the local authority to help get the ball rolling, to reach out that little bit further and widen your participation. So I'd just like to end now by saying thank you very much to all those who have attended today, and a short questionnaire will launch at the end of this webinar. It's really important. We'd really appreciate you to give us your feedback. Please take the time to complete the questionnaire, as it helps us plan for future online training events, including what topics you would like to see covered. So the recording of this webinar, presentation, questions, handouts, any other resources will be hosted on the Contact a Family website next week, and an email confirming this will be sent to you once this is available. If you want to send, if you have questions at the end of this and you think, oh, I wish I'd asked this question, you can email Helen Reid at Contact a Family, who is hosting this webinar for us and is the webinar administrator. So I urge you, please send your emails in to Helen, even in a couple of days' time, if you think of something that you wish you'd asked.